Hello, hello, hello. Thank you again for watching the other videos that I posted early on here at Just Upright. Again, my name is Gina Lynn. I go by Jane Ruder. I'm a physical therapist. I've been practicing here in the US here for 8 years now. And I used to be a review lecturer in the Philippines for 8 to 9 years. And my passion is really teaching. So that's why I made this YouTube channel. So what I'm going to discuss today is about the sit lift chair. Is this good or bad for you? Please bear in mind what I'm going to discuss is the recliner, the electric recliner that goes up, that helps a person to almost really stand up, not just the recliner that reclines you back and then sit you up. This kind of recliner is the one that really, as you can see on the picture, is the one that helps a person really almost stand up. So I'm discussing this because I have had so many experiences with patients using this inappropriately. So I made some research, and if you want the references, it's at the end of the slide of this presentation. I have listed the references there. And until I did that, I didn't know that the sit lift chair was being covered by Medicare since 1978. So actually in 1989, I read a report of the Inspector General. They made a study about the sit lift chair. So they define the sit lift chair as a mechanized chair that assists a person in standing up and sitting down alone. So the SLC has been covered, by Medicare program as a durable medical equipment, or what we call DME, since 1978. So what happened is from 1984 to 1985, the claims for this sit lift chair more than tripled from 200,000 claims to 700,000 claims. So the expenses of Medicare skyrocketed from 33.7 million to 63.3 million for the sit lift chair claims alone. So, and they blame this, if you read the anti-report, they blame this for commercialism. There was a big push from the sellers to the patient that they would say, oh, Medicare will pay for this, we will take care of the paperwork. And they even mentioned there that even before the seller received the physician order, they actually delivered the chair to the patient's house prior to receiving the physician order. So it was a big deal way back then. Why was this happening? And let's discuss first what is DME, or durable medical equipment. For Medicare, there are four conditions that an equipment can be called a durable medical equipment. Number one, it can withstand repeated use, so that's why it's called durable. Number two, primarily and customarily used to serve a medical purpose, and that's a biggie. Generally is not useful to a person in the absence of illness or injury. If you're healthy, you don't need this DME, and is appropriate for use in the home. So if you go to medicare.gov, G-O-V, that is the official Medicare website, and you can see the list of all the DME that Medicare covers. So these are just some of the examples: wheelchair, hospital bed, walker, and usually, and there are exceptions to the rule, Medicare will cover one durable medical equipment within 5 years, unless the condition of the patient drastically change and there's another need for DME based on the recommendation of the doctor or certified by the physician. So again, you can go to medicare.gov to learn all the coverage about the durable medical equipment per Medicare. So after they did that study in 1989, they made some recommendations. So what they recommended is more strict rules for coverage for a sit-lift chair. It should be really medically necessary, and the doctor really signed off that patient really need the sit-lift chair, and no delivery prior to physician's written order. And if you read further, um, there are sellers that should be Medicare certified for them to be covered by Medicare. So they follow more strict rules in um, covering for a sit lift chair. But right now in the US, even if you don't ask Medicare for coverage, many people actually can afford to buy this sit lift chair. You know, it's not anymore like a very expensive compared years ago. So it's like when you go to the mall, they have sit lift chair. It's readily available, and anyone can practically pay out of pocket or using their credit card for this chair. So what is medically necessary? So this came from Medicare.org, and this is a non-government site. Okay, so I'm just gonna quote this. Medically necessary for indication for sit lift chair are the following: the patient has severe arthritis of the hip and knee, or severe neuromuscular disease. The patient is completely incapable of standing up from a regular chair, and when standing, the patient can walk independently or with the aid of a walker or a cane. Transferring directly to wheelchair can prevent Medicare from paying for the device. So I was thinking, why is this so? Because if you really need a wheelchair, they will cover the wheelchair, not the sit lift chair. The sit lift mechanism is part of the physician's course of treatment to effect improvement or slow deterioration in patient's condition, which I find a little bit questionable. I can understand slow the deterioration of the patient's condition, mainly because they're thinking if there is no a sit lift chair that will help the patient to stand up, the patient will just be stuck in the chair and will not get up. But I cannot see the improvement of the condition with the sit lift chair, and I will discuss this shortly from the therapist's point of view. So let's step back a little bit, and why for us to understand where I'm coming from as a physical therapist. So what's happening in our body as we grow old is there's a phenomenon or an event called sarcopenia. And sarcopenia refers to the loss of muscle mass that occurs with aging. So if the mass, the bulkiness of our muscle decreases, the strength also decreases. So for a young person, the lean muscle mass is 50% of our body weight, total body weight. But as we grow older, particularly 75 to 80 years old, it lessened to 25%. So it's like 50%, lesser than we were younger. So it means we are getting weaker as we grow older. So the quadriceps cross-sectional area decreases up to 40% between ages of 20 and 80 years old. So quadriceps, guys, in the therapy world, we know this. This is the bulky muscles in front of our thighs. And this is a very important muscle in order for us to stand up. There are many factors to losing muscle mass and strength, but the most common is physical inactivity or being sedentary. And if a person revert or decided to use a sit lift chair instead of pushing his or himself up, that is physical inactivity. We are accelerating the sarcopenia in our body. So my personal professional opinion, yes, the sit lift chair has indication for medical purposes, such as, for example, paraplegia, or, in case of spinal cord injury and there's really no motor control, muscle control, waist down, the patient has no capability of standing up on her own because of this condition. Yes, the patient may use the sit lift chair. Or for example, in case of after open heart surgery, cardiac surgery, and the surgeon said no pushing with arms, to stand up, or pulling, and for example, severely debilitated patient, in the process of regaining the strength, we can temporarily use the sit lift chair. So these are some very few examples that sit lift chair can be indicated. But the problem is, if a person use the sit lift chair on a daily basis because it is easier to stand up with this chair rather than pushing him or herself up to stand up. So I always say to my patient, when you go to 7-Eleven or any convenience store, you know that the prices of their products are higher because it's convenient. It's easily accessible 24/7. So you pay for the convenience. If you use the sit lift chair because it's easier, because you don't want to exert effort to stand up, you will pay a high price with your independence. How so? If you let the machine do the job for you and your muscles are not engaging or being activated every day, it will shrink, it will weaken. If you don't use it, you lose it, is very, very true for the muscles. So the next thing you will observe, it will be harder to stand up from a regular toilet. It will be harder to stand up from your friend's chair that doesn't rise up. It will be harder to stand up from a restaurant's chair because it doesn't rise up for you. And people who use this on a regular basis, based on my experience, are the most common fallers. They will fall, they will fall, they will fall, then eventually they will fall and fracture their bones. And what is the effect of falling and having a fracture? It can be a temporary or a long-term loss of independence, depending on how you recover from rehabilitation. And another devastating effect of fall is actually the fear of falling, especially among older adults. Physiologically, their body and psychologically, their mind is fearful of falling again, that they will stop doing the activities they used to do because they don't want to fall again. So there goes the vicious cycle of inactivity, weakness, and then falling. So that's why I always tell my patient, use what you still have for as long as you still can. And do not go to the easy way, because again, we pay if we go through the easy way, easy process. Difficulty to stand up from a seated position is a sign of weakness, or it can be tightness of the muscles of the legs, or both. The solution is not the chair lift. It might be a bandage or a band-aid, but not the solution. I would highly recommend, if you start noticing it's harder for you to get up from a regular chair, you call your doctor, asked to be referred to a physical therapist, especially physical therapists specializing in fall prevention. And things will not change unless you make you make a drastic intervention to address the problem. So if it is weakness, we need to strengthen the muscles. If it is tightness, we need to stretch that tight muscles to improve the balance of the patient and to decrease the fall risk. So the chair lift or the sit lift chair in the long run may cause more harm than good. So I hope you have some good takeaways from this lecture. And if you have any questions, you can always email me at justuprightllc@gmail.com. These are the references for this discussion. And I hope you have a great day. Stay blessed. Thank you for watching.